guys, this is Sunit, and again, welcome to the Infomaniacs. And here I am presenting you the novel coronavirus pandemic part 2. Okay, but before watching this video, I would like to tell you to please like, share, and subscribe. It will help us a lot. So, okay, let's begin. So guys, people are really panicking about this coronavirus, but let me say there are viruses which are more dangerous than this. Okay, this is having a positive sense RNA, which is a double stranded, and it is having a non-segmented genome. Okay, the virus which have segmented genome like Bunia virus, orthomyxovirus, and reovirus, arnivirus, these are more dangerous than coronavirus. Okay, and on the screen you can see there is a comparison between the influenza and COVID-19. Okay, and here we can see the medial incubation period is 2 days for influenza and 5.5 days for COVID-19, and also the other parameters also can see but we are the major concern is not about this, but the major concern is about the mortality. Okay, as we can see the mortality of influenza is 0.1% and that of COVID-19 is 3%. But actually it is not true because we are unprepared in this condition, that's why it is 3% in Italy. Okay, it is 7 to 8%, and so whenever the technology will get pace, then this will decrease up to 1%. This is this data, this all the data are also given by WHO, you can verify it. Okay, and also the reproductive number, look at it, it is 2.25. that is what we should be concerned about, not the other data about okay. uh, Okay guys, and now you can see in the screen that there are some advices by our honorable prime minister of social distancing. Not only our honorable prime minister suggesting it, but also the other world leaders like Justin Trudeau, Donald Trump, Emmanuel Macron. So we should know that what is social distancing. Okay, so here in the screen you can look about what is social distancing. So it is a strategy which includes way to stop or slow the spread of infectious disease, mean less contact between you and the other people. मतलब कुछ समय के लिए आप सोशल डिस्टेंसिंग अपनाएं और लोगों से थोड़ा सा दूर रहें, तो उससे एक फ़ायदा ये होगा कि ये जो डिजीज़ है वो उसका स्प्रेड बहुत घट जाएगा। मैं जैसा पहले बता चुका कि उसका जो रिप्रोडक्टिव नंबर 2 to 2.5 है, मतलब आपको अगर ये इन्फेक्शन है तो आप 2 से 2.5 लोगों को आप ये इन्फेक्शन दे सकते हैं और फिर वो 2 से 2.5 और ये ऐसा ही बढ़ता जाएगा। Okay guys, here you can see the epidemiological curve of the COVID-19 disease. Okay, and here you can see how much it is exponential. And so what is our target? That by opting various protective measures like personal which comprise of hygiene and community, social distancing, environmental clearing surfaces, we can flatten the curve, because if we can see if there is no intervention on the second picture you can see, then the curve will reach to its peak. Okay, and this is the point where all the medical facility and all the medical arrangements fail, so there is much death like the condition in Italy. So you here you can look over the severity of the diseases. So unlike the flu, okay, 80% are mild cases and 15% are severe cases and 5% are the critical cases. Okay, in severe cases we have to give supplemental oxygen. Okay, so there will be a requirement of more hospital beds. Okay, and in the critical condition, that is the 5% cases, we require to give the elective ventilation. And remember, unlike the other cases, here we have to give it, and we shouldn't wait until the carbon dioxide increases or there is a respiratory failure. Before that we must intervene. Okay, this will save the life, and this can decrease the mortality up to 10 times. So who are considered to be a suspected case? Okay, on the screen you can see it is the definitions that is given by the World Health Organization. So whom we can consider a suspect? Okay, the person who is coming from an area where the disease is prevalent. Okay, the infection is prevalent, or the person who come into the contact with that infected person, or this could be the person like healthcare workers who are treating this patient. तो मैं एक एग्जांपल देता हूँ, जैसे कि अभी कोलकाता में एक पेशेंट आता है। ओके, वो लंदन में पढ़ाई कर रहा था, तो वो इन्फेक्टेड था। तो वो यहाँ पर आता है और एक फॉर्जरी करता है कि झूठ बोलता है कि मुझे कुछ नहीं हुआ, एंड ही वेंट्स टू द होम। और उसके कांटेक्ट में तो वो एक पर्सन है, क्योंकि वो तो जहाँ से आया है वो एक प्रेवलेंट एरिया था, और दूसरे उसके पेरेंट्स, पड़ोसी और ड्राइवर जो कि उसके कांटेक्ट में आए हैं, और तीसरे ऐसे लोग हैं लाइक डॉक्टर जिसने उसको पहले डायग्नोज किया। तो ये है प्रोबेबल, दिस आर द सस्पेक्ट केस। ओके, so who could be the probable cases? They are the suspect cases for whom the testing for COVID-19 is inconclusive. Okay, and who are the confirmed cases? A person with the laboratory confirmation of COVID-19 infection, irrespective of the clinical sign and symptom. If the laboratory diagnosis come positive, then it should be considered to be a confirmed case, even if he is not showing any symptoms. Okay, so what are the differential diagnosis of this condition? Okay, the differentials could be the H1N1 or swine flu, H5N1 or avian flu, and infection by respiratory syncytial virus, rhinovirus, influenza virus, para-influenza virus. These are the probable differential diagnosis. Okay, so there is a long laboratory diagnosis, and it is given in a very good detail in the WHO website, and you can check there. Here I'll be talking about the specimens, that what specimen you should take. Okay, okay, in the case of a lower respiratory tract, you can take the sputum or aspirate, or you can do a lavage. Okay, in the upper respiratory tract, you can get an esophageal swab or oropharyngeal swab, or an esophageal wash. Okay, and in, if you are doing a autopsy, you can send the stool, blood, urine, another. Okay, okay, in this picture you can see an esophageal swabbing is being performed. Okay, WHO recommends to use a synthetic fiber swab with plastic shaft, and wooden shaft with calcium alginate swab should be avoided here. Okay, and for protection, always use purple nitrite latex gloves, and there should be a 70-degree extension of the neck, and the swabbing should be done parallel to the upper palate. And okay, for the oropharyngeal swabbing, which the specimen should be taken from the anterior and posterior arch, and it should be remembered that we shouldn't touch tongue or teeth or cheek, any part in the oral mucosa. Okay, and if the patient is in mechanical ventilation, then tracheal aspirate, bronchoalveolar lavage can be done. Okay, now the testing is by real time PCR, and I should remind you that government is doing it for free, but it actually actual cost is around 5,000 rupees. So whenever the specimen are given for the testing, we should be vigilant. Okay, okay, now we are looking at the X-ray and the CT scans, and in the CT scans you can see there are bilateral lung infiltrates, and here you can also see that there is a ground glass appearance, which is the characteristic finding in the pneumonia which is caused by COVID-19. And the white patches which you can see, these are the air bronchogram, and basically the person of the person whose CT scan is it is basically he is drowning, because the fluid is filled, and you can see the right lung which is nearly obliterated. And now also there, but in the lungs you can find that there is no cavitation or no nodule formation, and also there is no lymphadenopathy. Okay, and now look at the X-ray. Here it is evident that it is a AP view X-ray, because it is a illness day 12. So the person must be lying down, and you can find that from the x-ray because there is no gastric fundus seen, and the right hemidiaphragm is at the higher level than the left hemidiaphragm. Okay, and here you can also find that the cardiothoracic angle, the cardiothoracic ratio, it is normal, and uh, unlike in cardiopulmonary edema, that where the cardiothoracic ratio increases, and here we can see there are bilateral infiltrates, and there is no left arterial hypertrophy which is seen in the left, of course the arterial hypertension. So we can diagnose that this is acute respiratory distress syndrome. Okay, and of course the cardiac shadow is also looking normal. Okay guys, though in the screen you are looking for the protocol of the treatment for the confirmed cases of the COVID-19 which is suggested by the CDC. So you can go through it, and here CDC is suggesting chloroquine phosphate, which is an anti-malarial drug, oseltamivir, atazanavir, and corticosteroids. But still the use of the corticosteroids is debatable between the doctors, like methylprednisolone and ibuprofen, and some other kind of the drugs are also being used like remdesivir and flavilavir, which are approved in China, and they were previously used by in Ebola cases. Okay, but still these are not FDA approved. And about the vaccination, you must have known that already the trials have begun in America, and 20 sorts of such vaccines are currently being developed in various parts of the world, and within a year most will be available in the market. So generally what happens on 7th or 10th day of the illness, a patient will arrive with a serious worsening condition. Then he will say that he is having a dry cough and shortness of the breath and a fever. Okay, a mild grade fever. And when you'll be measuring the measuring various parameters, and we will find that SpO2 by FiO2 ratio or PO2 or FiO2 ratio is relatively less than the normals. Okay, so now here we come across ARDS, okay, which is also called as the acute respiratory distress syndrome. Actually, it is a life threatening condition that prevents the enough oxygen from getting into the lungs. And in this case, the cause of the ARDS is pneumonia. Okay, uh, so ARDS leads to a buildup of fluid in the air sacs. This fluid prevents enough oxygen from passing into the bloodstream. The fluid buildup also makes the lung heavy and stiff. This decreases the lung's ability to expand. Okay, so the lung compliance is decreasing over here, and due to which the PO2 is decreasing and hypoxia is presented. Okay, in COPD normally the PCO2 is increased and there is respiratory acidosis and hypercapnia, and that is the cause of the morbidity. And but here it is type 1 respiratory failure due to hypoxia, due to the decreased compliance of the lung because of the ARDS presented by the bilateral pneumonia. Okay, so use of the drug in this case is secondary. Our first objective is to give our lungs the appropriate time to take rest. Once it is given, then the lung will self heal itself. The major thing that we should remember is that timely elective ventilation is very necessary. We shouldn't wait for PCO2 to rise, or wait for a respiratory failure. We should give it immediately once the diagnosis of ARDS is made. And all the management procedure are also called as the lung protective ventilation strategy. Okay, so once the diagnosis is made, then we opt for rapid sequence intubation, okay, where we give high flow of oxygen, which is followed by the low volume ventilation, and we watch for the SpO2 meters. And if it still falls below the 90% in spite of giving a high flow of oxygen, then we opt for the invasive ventilation, unlike the case of the COPD where we opt for the non-invasive ventilation. So after that it is followed by the neuromuscular blockade for 24 hours. Okay, and why we perform a neuromuscular blockade? It is to prevent the barotrauma or tension pneumothorax or alkalosis. And why this happens? Because due to the lungs is also performing a function and the ventilator, so there is a high chance of the asynchrony. Okay, so now there is a prone positioning. Okay, and means normally we see that ventilation is performed with a supine position. And why in this case we are performing prone position? Because in the prone position we can see in CT scan the densities redistribute from the dorsal to ventral, as the dorsal region tend to re-expand while the ventral zone tends to collapse. Although the gravitational influence is similar in both the position, the dorsal recruitment usually prevails over the ventral de-recruitment because of the need for the lung and its confining chest wall to conform the same volume. The final result of the proning is that the overall lung inflation is more homogeneous from the dorsal to ventral than in the supine position. Okay, with more homogeneously distributed stress and strain, as the distribution of perfusion remains nearly constant in both the postures, proning usually improves the oxygenation. Okay, so this is the reason. Okay, after this we perform a prone position ventilation. Okay, and in the ventilator we set the tidal volume to be 6 ml per kg. Okay, unlike the other condition in which we set it for 12 ml per kg like diaphragmatic paralysis, Guillain-Barré syndrome, transverse myelitis. And you must be wondering that why it is 12 ml per kg, because if we consider a normal average weight which is 60 kg, then it comes nearly 720 ml. But we have read that in physiology that the normal tidal volume is 500 ml. But we should remember here that the weight is lean weight. Okay, not the all the. Okay, so here we've already discussed about the ventilation, and it is the PEEP ventilator, or which is also called as the positive and expiratory pressure ventilator. So what is positive and expiratory pressure? It is the pressure in the lungs above the atmospheric pressure that exists at the end of the expiration. Okay, there are two types of the PEEP, which are extrinsic PEEP and the intrinsic PEEP. And also we should remember that the plateau airway pressure, we should set it at ventilator less than or equal to 30 centimeter of water. Okay, now if this ventilation also doesn't come into work, then we can use the ECMO machine, or which is also known as the extracorporeal membrane oxygenation machine, which actually perform the oxygenation for you. The main concept for performing ventilation or ECMO. So what is the main objective of using ECMO or ventilator over here? So we can give a sufficient time to the lungs to heal itself. That's the main strategy behind all of these things. Okay, therefore you must have heard about the news that China is giving more than 1000 ventilators to Italy for combating this. Okay, uh, so what is the cause that there were so many deaths in the Italy even after it being a developed nation? The reason is the lack of hospital bed and the ventilators. Even if we quarantine the people after getting infected, but if they develop ARDS, then the ventilator is a must. And suppose if 600 700 people flock to the hospitals at a time, then can we provide them the ventilator? No. And that's the reason of the vast deaths that have taken place in Italy. Therefore we should hear and we should listen and we should follow all the instructions that is being given by the state government and the central government, and help them to tackle this situation, because if it come otherwise, then we are lacking facilities. Okay, so that's it. So guys, thank you and have a nice day. and take care.